Hey folks! Are you ready for a serious yet super important topic today? Well, hold on to your hats because we're gonna talk about prostate cancer. Did you know that prostate cancer is one of the most common types of cancer in men? Yep, that's right. It mostly affects men over the age of 50, but it's never too early to learn about the warning signs. And let me tell you, it's not all doom and gloom. While prostate cancer can have serious consequences if left untreated, the good news is that it's often treatable if caught early. So buckle up and let's dive into the 10 major warning signs of prostate cancer. Trust me, you'll be glad you did. Frequent urination. Let's talk about number 1 on our list, frequent urination. Now, we all know what it's like to have to use the bathroom more often than usual. Maybe you drank too much water or had one too many cups of coffee. But if you find yourself making more trips to the bathroom than usual, especially at night, it's time to pay attention. Why? Well, it could be a sign of an enlarged prostate. The prostate is a gland that sits just below the bladder, and as men age, it can start to grow. And if it gets too big, it can start to put pressure on the urethra, the tube that carries urine out of the body. This can lead to that feeling of needing to go all the time, even if there's not much urine coming out. Now, an enlarged prostate doesn't necessarily mean prostate cancer, but it can be a precursor to it. So, it's important to get checked out by a doctor if you're experiencing this symptom. Difficulty starting or stopping urination. This can be a frustrating and uncomfortable symptom, as you may feel like you have to go all the time, but can't quite get the job done. It's like trying to start a stubborn lawnmower. You pull the cord and nothing happens, or it sputters and stops. Not fun, right? Well, the same goes for difficulty starting or stopping urination. It's important to get checked out by a doctor, as this symptom can indicate an enlarged prostate or other underlying health issues. And let's face it, you don't want to be stuck in the bathroom all day trying to empty your bladder or rushing to the toilet every 5 minutes. So, if you're experiencing the symptom, don't hesitate to make an appointment with your doctor. Flow or lack thereof. Number 3 on our list is all about the flow or lack thereof. So, picture this. You're standing at the urinal minding your own business, but the pee isn't flowing like it used to. Maybe it's a weak trickle, or maybe it feels like you're only getting started before you have to stop. That's no fun, is it? Well, it turns out that this can actually be a sign of prostate cancer. You see, the prostate gland surrounds the urethra, which is the tube that carries urine from the bladder out of the body. If the prostate becomes enlarged or develops a tumor, it can put pressure on the urethra, making it harder for urine to pass through. And that's when you might start experiencing those pesky interrupted flows. So, if you're experiencing weak or interrupted urine flow, don't just brush it off as an annoyance. It could be a sign of something more serious. Talk to your doctor and get checked out. Blood in the urine or semen. First of all, let's get one thing straight. Seeing blood in your pee or semen is definitely not something you should brush off as normal. While it can be caused by a number of things, including infections, kidney stones, or even vigorous exercise, it's important to rule out the possibility of prostate cancer. Now, we know that the thought of having prostate cancer is scary, but don't worry. Just because you're seeing blood doesn't mean that you have it. However, it's still important to get it checked out by a doctor. They'll be able to perform some tests and figure out what's going on. And if it turns out to be prostate cancer, remember that early detection is key. So don't be afraid to speak up and seek medical help if you're seeing blood in your pee or semen. Pain or discomfort in the pelvic area. Now, we all get aches and pains from time to time, but if you're experiencing persistent discomfort in these areas, it's time to take notice. Prostate cancer can cause these types of symptoms because the prostate gland is located in the pelvic region. As the cancer grows and spreads, it can put pressure on nearby nerves and tissues, leading to pain or discomfort. Now, we know it's easy to brush off a little pain or discomfort as just part of getting older or being active, but don't ignore persistent symptoms. Erectile dysfunction. Now, let's talk about something that might make some of you uncomfortable, but it is important to discuss: erectile dysfunction. Yes, I said it. It's not just an awkward topic you try to avoid. It's a real issue that affects a lot of men, and prostate cancer is one of the possible culprits. You see, the prostate gland is located near the base of the penis, and if the cancer starts to develop, it can affect the nerves and blood vessels responsible for getting and maintaining an erection. So, if you're experiencing difficulty in the bedroom, it's important to consider the possibility of prostate cancer. Of course, there are other factors that can cause erectile dysfunction, such as stress, anxiety, and even certain medications. But it's always better to be safe, so make sure to talk to your doctor about any persistent issues you may be having. Loss of bladder control. We know, it's not the most glamorous topic, but it is important to discuss. If you're finding yourself suddenly having to run to the bathroom all the time, or having trouble controlling your bladder, it could be a sign that something is amiss. Now, we know that accidents can happen, especially as we get older. But if this is a persistent issue, it's time to see a doctor. They can help determine if it's a result of an enlarged prostate or something more serious, like prostate cancer. Feeling fatigued or weak. Now, let's talk about number 8 on our list: feeling fatigued or weak. Now, I know what you're thinking. Oh, great, just what I needed. Another reason to feel tired. But jokes aside, this is actually a serious symptom that shouldn't be ignored. While fatigue and weakness can be caused by a number of things, including lack of sleep or stress, they can also be symptoms of prostate cancer. This is because the cancer can spread to other parts of the body, like the bones, and cause weakness and fatigue. So if you're feeling more tired than usual or just generally weaker, it's important to pay attention to your body and get checked out by a doctor. Don't just brush it off as a normal part of aging or a busy lifestyle. Now, I don't want to scare anyone, but it's important to remember that early detection is key when it comes to prostate cancer. If you catch it early, there are many treatment options available that can help manage the cancer and improve your quality of life. Unexplained weight loss. Now, we all love shedding a few pounds without trying, but if you're losing weight and you can't explain why, it's time to get checked out. It could be a sign of an underlying health issue, including prostate cancer. Weight loss without trying can be a tricky symptom to diagnose, but it's always worth getting checked out. It could be a sign of cancer or other serious conditions, so it's better to be safe than sorry. Plus, if it turns out to be something else entirely, you can at least put your mind at ease and stop worrying about it. So, what should you do if you're experiencing unexplained weight loss? Well, the first step is to see a doctor. They can run tests and rule out any underlying health issues, including prostate cancer. They might also ask you about your diet and lifestyle, so be prepared to talk about what you've been eating and how active you've been. If it does turn out to be prostate cancer, don't worry. There are treatment options available. And remember, the earlier the diagnosis, the better the chances of successful treatment. So, if you're experiencing unexplained weight loss, don't put off seeing a doctor. Bowel changes. Yes, you heard it right. Prostate cancer can sometimes cause changes in your bowel habits, such as constipation or diarrhea. Now, before you start freaking out, let's understand why this happens. You see, the prostate gland is located near the rectum, which is part of your digestive system. And if the cancer is spread to nearby tissues or organs, it can put pressure on the rectum, causing bowel changes. So, if you're experiencing constipation or diarrhea that's just not going away, it's important to talk to your doctor. Don't be shy or embarrassed. Trust us, they've heard it all before. Your doctor will be able to do some tests and figure out what's causing your symptoms. So, there you have it, folks. These are the 10 major warning signs of prostate cancer. If you're experiencing any of these symptoms, it's important to see a doctor as soon as possible. Remember, early detection is key in the fight against prostate cancer, so don't hesitate to get checked out. Stay healthy and take care of yourselves. And don't forget to like, subscribe, and share this valuable information to your loved ones. We will see you in the next video.